corpi mobili vitreali,
Vitreous floaters, technically called floaters, but more commonly known as flying flies, are the result of the chemical physical variation of the vitreous body, a gelatinous and transparent substance that fills the eye. A thorough eye examination is very important to identify, document, and choose any therapeutic strategies to treat the disorder. What is the vitreous body for? The vitreous body offers the eye mechanical and nutritional support, as well as providing, thanks to its transparency, an optical function. How are flying flies formed? Over the years, particularly after 45 and 50 years of age, the chemical and physical composition of the vitreous body undergoes some variations. This determines a certain inhomogeneity, which results in the formation of clusters of collagen fibers and/or cells. These clusters remain suspended in the vitreous body, floating in its structure. This phenomenon, known as posterior vitreous detachment, is a common occurrence in people over the age of 45 and generally occurs without causing any problems. However, in some cases, the vitreous body can maintain a certain adhesion with the retina, exerting on it a traction force known as vitreoretinal traction, which can be followed by the development of retinal tears, small hemorrhages inside the vitreous, and the development of numerous floaters. These events are often accompanied by the perception of light flashes, linked to the fact that the retina is able to transform mechanical impulses, therefore also tractions, into light impulses. The sudden appearance of floaters, especially if accompanied by light flashes, requires immediate specialist evaluation as a possible symptom of retinal breaks, which in turn could create the conditions for a retinal detachment. How are vitreous floaters perceived? In the presence of light, the vitreous floaters cast their shadow on the retina, and this is ultimately perceived as a movable body in the visual field, which seems to move together with the eye's movements. The shapes of the movable bodies can be different: dots, circles, lines, clouds, or cobwebs. They are all usually noticed when looking at a light background, such as a clear sky, a sheet of paper, or a light wall. Are vitreous floaters harmful? The floaters that are formed due to the natural transformation of the vitreous body are not as harmful or dangerous for the health of the eye. However, they are often the reason that allows to reveal otherwise asymptomatic retinal degenerations, and therefore a visit is always recommended. Usually, they do not interfere with vision. Therefore, in these cases, it is not necessary to intervene in any way unless peripheral retinal degenerations are diagnosed as an accessory finding, which may require prophylactic laser treatment for retinal detachment. Other times, when they are of considerable size, they can interfere with the performance of normal daily activities, significantly altering vision. How and when should we intervene? Today, there are no surgical treatments for vitreous floaters with standards of efficacy and safety comparable to other surgeries, such as, for example, cataract surgery. Despite this, laser vitreolysis and minimally invasive vitrectomy are proposed. Vitreolysis, through small pulses Emitted by a YAG laser, the mobile bodies are vaporized and reduced in size. This treatment is performed without surgically penetrating the eyeball. In order to carry out the treatment, the floaters must be at least 2 millimeters away from the retina and the lens, and there must be no simultaneous active inflammatory states of these structures. The treatment is carried out on an outpatient basis. The possible complications induced by laser vitreolysis are increased ocular pressure, cataracts, and retinal detachment. Minimally invasive vitrectomy. Vitrectomy refers to the surgical removal of the vitreous body, which can be performed with specially thin-gauge surgical instruments. The instruments used, called vitrectome, is an aspirator equipped with a very high-frequency guillotine cutting system, up to 10,000 cuts per minute, in order not to create tractions on the retina, through which the mobile vitreous body is cut and removed. The most common complications induced by minimally invasive vitrectomy are retinal rupture, retinal detachment, increased ocular pressure, and cataracts. For any other details, consult your ophthalmologist, who will illustrate, according to your specific case, the most appropriate therapeutic conduct, making you aware of the advantages, risks, and benefits.
Ridotto su vantaggi, rischi e benefici.